Well, hello, welcome everybody. Again, I'm Peter Catalano. Welcome to the interview. As you all well know, I love meeting great business owners. Some people work for great business owners. Some people are the big business owners throughout the Houston area. And today I get the absolute privilege of meeting with Dr. Justin Lay. Lay? How am I saying that?
Lie is good.
Lie is good. I call you Dr. Justin, but we'll make sure I say it properly. So, Dr. Justin, thank you for being with us on the interview here today. Folks, dentistry. Yeah, as soon as I said the word dentistry, I had drills swelling in my ears over here, which made me probably want to turn the video off, and I'm recording it. But look, Dr. Justin is amazing. And when I say he's amazing, he's extremely technologically advanced. And he has a great way of working with his patients to give as much comfort as possible to deal with the teeth issues. So, Dr. Justin, thank you for being on the interview here today.
Yeah, thank you for having me.
My pleasure. Listen, technology. Well, first of all, process of my interview, I like to know a little bit about you. I don't want to jump too far ahead here. So a little bit about you. You're Houstonian, you dental school, kids.
Yeah,
What's your story?
So I'm a native Houstonian, born and raised in Houston, southeast side, kind of Pearland, Pasadena, Clear Lake area. For about 30 some odd years now. Did my undergrad at Rice University, and did dental school in San Antonio, and then came back to work after I graduated from dental school on the west side of town. So my office is Edge Dental over on the west side in the energy corridor. So it's kind of in the middle of where everything's going on, Houston-wise growth, and where everyone is. But yeah, it's dentistry. I started studying school. I started chemical engineering. Both my parents were engineers, so it seemed at the time the logical path for me to take. And then kind of once I kind of got into it, I really wanted to do something a little more hands-on, and that's what kind of drew me to dentistry on that. So
that makes sense.
Switch to dentistry, and I think that engineering background does give me a little bit of an edge in terms of kind of being able to think outside of the box and problem solve and troubleshoot. Because dentistry, everyone's mouth is a little different, so not everyone's a textbook case. So that gives me a kind of outside perspective to kind of help my patients a little better than maybe someone that is kind of more traditional thinking might be able to.
Well, you need, it sounds like you've got the skill sets to apply your engineering mind into this area, right? And not see it as things. So tell me a little bit. I know we had talked in the past, and you had shown you're really technologically advanced. I mean, you are doing things that I have not seen in dentist office, not that I visit them frequently, but you're doing some things. You're showing people what's available. You've got great technology in the office. Just give us a brief little, why so much technology?
Yeah, so really, main thing that when I started the office, I really wanted to kind of showcase technology more of so as kind of a patient education tool. It's more of a kind of dispelling that fear of the dentist. A lot of times that fear is just because patients don't know what's going on in their mouth, and then they're supposed to just take what dentists tell them at face value. But in this day and age, everyone's we're told to be skeptical and always questioning things. So that the technology really bridges that gap between what the patient knows and what we're trying to teach them. So for example, for our exams, we take your standard x-rays, but we also have a camera that kind of go in the mouth and take pictures of your teeth, and then we can kind of just put that on the big screen and show you exactly what's going on with the tooth. We also have a 3D scanner that we can take a 3D model of your teeth without having all that goopy impression material that everyone likes to
Hates.
choke and gag on.
Mm.
I personally myself, I hate that process as a patient. Because I went through orthodontics, when I was little, and I remember, gagging,
Mm.
as soon as they put that stuff in my mouth.
Oh.
But yeah, we can do all that digitally, and not only does that give a more accurate model of your teeth, we can kind of manipulate that model and kind of show patients, how their teeth fit, together, all of that.
That's amazing. Now you showed me one time, actually just recently, you showed me a model, and it was here's where you're at, and then you projected. I think you were using some sort of a orthodontics, but not the traditional braces, and you were showing how it was. I believe it was cosmetic, but you were showing, here, you were building trays, I guess, and showing that, here's what we can expect as we
Yeah,
go along, kind of seeing the future, right? Is that?
yeah. So really, the technology with with the orthodontic aligners these days, they've come so far, that with the software is so powerful that it can kind of show you the progression of how your teeth will move. Basically, we just need a input, where you're starting from, where we want you to end, and really the algorithm um, kind of does its work and moves the teeth, progressively to where it needs to be. And then with that, we can actually fabricate the aligners in our office, so we don't have to wait, for outside labs, third-party labs to kind of, typically, especially with supply chain issues these days, you're looking at about a month or 2 months before you get started with your orthodontic treatment. Whereas with us, we can pretty much within a week or two we can get you started.
Wow.
On
So
that.
it's kind of like what hit my head is CAD software for teeth. CAD
Yeah,
software and 3D printers have merged into the dental office. So
yeah,
it
that's
seems.
a pretty good representation of that.
Yeah,
So
it's
it's
fascinating.
it's just really cool to kind of sometimes you just kind of sit there and just play around, and kind of see what's possible. Because a lot of all the other companies, they set limits on how many trays they want to make per case, just because the more trays they make, the more it affects their bottom dollar.
Got it. Sure.
That's the reality of the business side of dentistry. But with us being able to kind of do it ourselves, we can kind of push past those financial limits. Really the cost of making them is pretty small compared to the rest of the treatment. So we can kind of extend treatment a little longer if we need to get where you want to be.
So talking about money, and we have a short window for this first time. Love to have you back and maybe show us some of the modeling that you do. It's really fascinating when I saw it. But the basics, right? You taking insurance? Is there a demographic? Are you looking for older people, younger people, kids? I mean, who do you take on as patients?
Yeah, so really we are full service, kind of serve everyone office. In terms of demographic wise, we see from infants all the way up to elderly, people with no teeth. So that we see kind of all walks of life. In terms of insurance, we do accept PPO insurances. We do not currently accept like HMO plans. Basically, those plans are the ones where you're assigned to a dentist. So we don't participate in those programs just because we feel like those plans limit what kind of treatment their patients are able to get. But yeah, we do accept PPO. We do accept patients with no insurance also. We have our in-house kind of savings plan for people without insurance, and we also do have several different payment plan options, either through our office or third party, depending on how large the treatment would be. So that we're pretty flexible financially in terms of individual financial arrangements on that.
That's fantastic. Now, um, Boy, I just thought of a question and it just left me as you were talking about money, and my head went right to the money for a minute there. Uh, uh, where were you going there? And where? Oh boy, this is the first time I've had a question that's lost my mind. So that's okay. Well, I guess it's something we'll come back to in the future. So you'll take on and work with. Oh, that's it. Your patient load right now. How long is it going to take to get an appointment with you? And do you have, if somebody needs their standard cleaning done and then initial x-rays, is that the standard in your office, the first time appointment as a
Yeah,
process?
so first time appointments, we do like to, big thing is patient education. So, our initial appointment is probably going to be a little longer than what most people are used to at their dentist. So you're probably looking at about an hour to hour and a half, for the initial kind of appointment. As far as how soon we can get you in, really, we just added on a new dentist and new hygienist. And they're really great, and that kind of opens up the schedule a lot because towards the end of the year we do get pretty busy. But right now we can probably get patients in within typically within about no more than 3 days. So if you have like an emergency, or something that's a little more pressing, we can get you in usually the same day.
Well, that's another unique thing about you, your hours. You're working late hours a couple of evenings, correct?
Yeah. So our late hours, like Mondays and Tuesdays, we're open until 8 p.m. And that's really designed more for um, people who might not be able to take off work or might have child commitment, throughout the day or in the mornings. That maybe they don't want to sacrifice a weekend going to the dentist, so that the late hours are very convenient for for patients that want to utilize
And then
that time.
one more thing, and then we have to wrap this one up. But I see posted all the time, all over Facebook, got an emergency, whatever that looks like. And do you take on emergency cases? Do you take on after hour cases? Does that work in your practice? I have no idea how that works.
So after hours, we do occasionally see after hours cases. Most of the time, dental emergencies can be managed without having to go to the dental office.
Okay.
A lot of times it might just be, like pain management until they can get in, um, or yeah, most of the time it's, dental emergencies typically not the same as like a medical emergency.
Okay.
So we typically just kind of over the phone, just, give recommendations on that. If
Okay.
it's, a true emergency, we can kind of get to the office, but most cases we can manage, just, virtually.
And
On
show
that.
up tomorrow, and
Correct.
you'll be okay. So get through the
Yeah.
night. I think I had a cracked crown one time. Half of it fell off. Of course, it was the middle of the night, and I'm grinding my teeth, and it was an emergency to me. I mean, the pain was there. But you're right, a little bit of fixident. They told me put the crown back on for the rest of the night, and bam, I was okay. And a bunch of Tylenol or codeine or whatever I had available,
All
and
right.
and we were okay for the night. So you're right. There, what's deemed a real emergency. But the key is you're available. You're able to help people walk through this process, and more than likely wait for them to come in the morning,
Right.
which is
Right.
access to you. I think is really the key, is
Yeah.
what I'm hearing. And you grant that access, which is absolutely wonderful with your service. Well, Doctor, thank you so much for taking this time on the interview here today. Love to have you back. Maybe show some of those great technology you showed us on the last presentation I saw from you. Extremely impressive. I know today was not planned, so that's what I like to do. I like to wing these. But thank you for being on the interview and sharing your practice with us.
Yep. Yep. Thanks for having me, Peter.
More than my pleasure. So we'll see you soon, and happy holidays to you.
Yep. You too.